Okay, good evening, everyone.
Good afternoon.
How you doing, Tatiana?
I'm good. How you feeling today?
I'm doing fine. It's getting colder and colder, so
It definitely is getting cold.
yeah. But this is, winter time that we're getting into, so probably this winter is gonna be really, really bad.
Yeah, I'm not prepared. I'm prepared for it. I just don't like being too cold.
Well, I'm prepared to leave. I'm leaving next month. I'm going out of the country, so I'm going to a tropical country. Yeah. How you doing, Xiomara? Okay. So let's see who else is gonna join the class. Good evening for those who just joined the class. Okay. So we're going to continue with this chapter today, the one that we started yesterday. So that's the legal and ethical aspects of healthcare. This is a little combination. Once again, kind of some of the information overlaps other chapters, but there are some things that I have not covered yet. So, and some of the things that is going to be on your exam. So for that reason, I want to cover them. Okay. So once again, at any time, any step of this class, if you have a question, please just feel free, ask me. Okay, so let's continue with this part, contract. We talked about the contract already. So very important, remember, in order for you to have a valid contract, you have to meet these particular criteria. So we're gonna go over this because this is important. So you're gonna have an offer and an acceptance. Remember, you must have these four criteria: offer and acceptance. So you must have someone offering you something. In this case, the hospital, the medical provider is gonna offer you the services, and you as the patient, you can accept it. Now remember, the doctors are not chasing, looking for the patient. The patient comes to us. It is up to us if we're gonna take the patients or not. So remember, the doctor has the right to select who patients they want to take. So if I don't want to take a patient, I'm not gonna tell them why. I'm just gonna tell them we are not taking new patients. That's it. Because otherwise, the patient can sue you for discrimination. So it is done, who doesn't want to have more patients? Well, unless we have too many patients and we don't have many providers that can take care of these patients, we do not accept new patients. That being said, you need to understand in your workplace, if you are in the front desk, you have to talk to the office manager, the supervisor, whoever is in charge of that office, and ask them if you guys are accepting new patients. So you have to, because the new patient can arrive and you start all the paperwork, and it turns out that later on someone is going to tell you, oh, no, no, we cannot take new patients. That's going to make you look really bad, and the patient or the potential patient is going to be upset because you are wasting their time. The only thing that you should say, oh, I'm sorry, we're not taking new patients. Instead, you ask them to give all the patient's information. Probably you make copies or their IDs, insurance, and all that paperwork. And at the end, somebody's going to tell you, oh, no, we're not taking new patients. So make sure that when you start working, you learn all these. You know exactly how to do things. Because remember, you're new. You're new there. You have to follow the policies of that particular organization, institution, field, office, hospital, whatever you want to call. So you have the new patient. The doctor is accepting new patients, so there is an offer, there is an acceptance. Now remember, it has to be a consideration. It has to be a payment for those services. Nobody works for free. So this is not a charitable organization where you don't pay anything. No, here you have to pay for the services, whether you pay from your pocket or you have health insurance. So you can ask about that also. You cannot register a patient without not knowing that this patient probably doesn't have medical insurance, or the medical insurance that they have is not taken by the office. So make sure that you familiarize with that too. Okay, so in this office, what medical insurance do you guys take? If you're working in a hospital, do not worry about that because you do not have to register the patients. There is other people in charge for that. You will not be doing that part of the job. You're going to be doing the administrative and clinical in a doctor's office, in a small clinic. In a hospital, you don't have to do that. They have other people to do the administrative work. Remember, the contract that we are getting into has to be lawful, under the law. So that's basically what it is. So this is legal. I'm a licensed medical practitioner. I'm going to offer you services. I'm going to charge for those services. This is legal. That's it. The person that we are contracting with has to be competent, meaning they mentally competent. What is mentally competent? An adult who has no mental conditions. There is no alcohol or drug abuse. That's basically what it is. Then we can have a contract. Remember, minors do not contract. People who have mental issues cannot sign a contract. If they do, it's voided. It's not legit. If something happens, they will not be responsible for payments, for anything. So you don't want to go into a contract because remember, hospitals, clinics, it's a business that is for profit organizations. So that's basically what a contract means. Now, this is the part that we left off. So breach of the contract. Remember, breach means to break the contract. We are not making this contract valid anymore. And what are the reasons? Abandonment by the physician. Remember, abandonment means the doctor, the office, the hospital is not contacting the patient when the patient has medication that has to be taken, has a procedure, patient is not following up, and you do not contact them. We have to contact them. We have to offer, reschedule, ask them to take the medications, to come back to the office, to follow up appointments. If they don't do it, we're going to document all that. And at the end, if they non-compliant with whatever the doctor is asking them to do, we're going to withdraw services. We are going to terminate services with this patient because this patient is going to get just in trouble. So how are we going to terminate this? You cannot tell the patient, okay, thank you very much, but we don't want to see you here anymore. That is illegal. That's called abandonment. So we're going to give the patient a prior notice, which is 30 days, a written document which is certified letter. Patient has to sign, and we're going to receive that confirmation that the patient signed. Whether the patient reads or not the letter is none of our business. We just did our part. That's it. After the 30 days, we are not obliged to take care of this patient anymore. The patient comes back and he says, "Oh, I want to see the doctor. I'm sorry, but you've been dropped from our system, from our services, been withdrawn, you've been dismissed," whatever word you want to use, and you were sent a letter 30 days ago, a month ago, 2 months ago. But if you need your medical records to be sent to your new provider, please let us know. Please authorize us, fill out a form of release of information. Now we can release your information. That's it. We're not obliged to see them anymore. There's no problem. Whatever they want to do, if they're going to make a scene over there, they're going to scream, not a problem. Let them do it. We do not intervene. That's how it is. Let's talk about the types of contracts. We kind of touch bases on this. Remember, express and imply. So express is a written contract or an oral contract. The most important contract has to be written because it's something where we have proofs, patient sign. But oral contract is just as valid because the patient signs registration form. So we are protected. Imply. Now, when we have something to do minor, not to register the patient, to start seeing the patient, they sign a registration form. Just like you signed the registration form for the school. You gave all your personal information, your education, background, probably render some certificates about high school, something else. Some of the requirements that the school have, you have to meet those requirements in order for you to join this program. And then you're going to tell them, they're going to tell you how much it's going to cost the program and how much you're going to pay and how you're going to pay. Any option plans that they have prepayments, whatever the case may be, now you are registered. So that's basically what it is. The same goes for the patients. We have to tell them exactly what's going to happen when they join our office. Now, for imply, this is a contract when you have already registered. It's not done, okay, I want to see the doctor. Sure, no problem, go see the doctor. And then you want to pay, you pay. Well, we don't have no contract. That's not what we're talking about. Imply is when you are already registered, you are already our patient, but we need to draw blood. We don't ask you to sign a paper to draw your blood, to do an EKG, to do vital signs. For certain procedures, we don't do it. We ask you to sign. Now that has to be an express contract, which is you have to sign, and we're going to tell you all the risks and benefits, probably other options, what's going to be done during the procedure. Remember, that's an informed consent, which is an express contract, by the way. So that's different. So implied consent is when the patient, whatever we're going to do, does not carry risks for the patient. What is the risk of drawing blood? The patient is not going to die because I poked them with a needle and I drew some blood, or I poked, no blood came out on the tubes. So what's going to happen? If the patient develops a bruise, that is not a motive. That's not malpractice. That's a very common side effect of drawing blood. Doing vital signs, what can happen during vital signs? Nothing. I'm just going to squeeze your arm, just going to check your pulse, your temperature. Nobody dies from that. An EKG, nobody dies from that. So Imply means I'm just telling you what I'm gonna do, and you just say. You don't say anything. You just do by your actions. So that's basically what it is. So the actions, the behavior of the patient is telling me that the patient accepts to do this. So again, just know that you need to know what is express contract. You need to know what is an implied contract for your exam. We talk about this, it's like a little more specific because I didn't give you, it wasn't written the definition about tort on the prior chapter. Here is telling you again, what is a tort? A wrongful act committed by who? Committed by anyone against someone else. That's a tort, but it applies in the medical. So the most common tort is called non-intentional tort. Remember, this is what we call malpractice. This is what we call negligence. Remember, the medical provider did not intentionally wanted to harm the patient. It's just that he was careless with the service. He wasn't paying attention. Use shortcuts just to finish right away without going through all the details. So that's basically what it is. That's what we call negligence. If the medical provider fails to act with a reasonable care means what another person, another provider in the same field could do in the same situation. I explained to you yesterday. If I'm a medical doctor, if I'm a family practice, and someone comes with a cough or with a fever, I have to ask a bunch of questions, do physical exam, do vital signs, ask a lot of stuff to try to figure out what's going on with my patient. But if you just assume that the patient is just having the flu and I send them home and something serious happened to them after that because it was something else, I'm going to be in trouble. That is negligence. That is tort. It's not that I didn't know what I was doing. It's just that I omit some steps. I didn't go all the way as supposed to, as someone else in my profession would do. So that's basically what it is. If you cause some harm to the patient due to your neglect, you're going to be accused or malpractice. So that's basically what it is. So if they ask you, what is a tort? So then it's a wrongdoing. It's a wrongdoing, and you are liable for that because a wrongdoing causes damage, causes an injury to your patient. That's called tort. Remember that the major mission of medical providers is to do no harm. That's basically what it is. Here, the patient was injured because of your negligence. So now you are responsible. Now you are liable. Remember, liable means you're responsible. For that reason, you will be penalized for not doing the right thing. That will be tort. Intentional tort. Now, that was non-intentional. Remember, negligence, malpractice, which is the wrongdoing, which is tort, it is unintentional. The medical providers did not actually do it on purpose. These ones right here, the person did it on purpose. That's what it's called intentional tort, assault. Now, when you threat a patient, the threat of a patient is called assault. We mentioned this. So patient is telling you, oh, well, I don't want you to draw my blood. And then you tell the patient, well, if you don't allow me to draw your blood, this is what's going to happen. We are going to withdraw your services. You're no longer allowed to come here. That's a threat. That's called assault. When you threat someone, you're not physically touching the patient. If I'm just threatening you and just cursing at you, I'm just trying to coerce you to do something that you don't want to without touching you, that's called assault. If I touch you without your permission, you're telling me, no, I don't want you to draw my blood, and you forcibly push me into the chair and hold my arm and put a needle there, or just push me into the chair and hold my arm right there, and you want to draw my blood without my permission, that is called battery. So again, you need to understand, because this will be questions for the exam, particularly battery, because it's touching someone without the patient permission. Remember, you have to tell every single patient when you're going to do a procedure that you have to physically get in contact with the patient. You have to tell them what you're going to do. The doctor ordered an electrocardiogram. Oh, no, I don't want you to do it. No, you're going to do it. Assault. Now you actually force the patient to go and change their clothes and push and touch the patient body. Most of the cases are both assault and battery, because you first threaten me to do something or coerce me to do something, and then you physically touch me. So that's assault and battery. When they ask you a question, they're going to say the act of touching the patient without the patient's permission, what is called battery. So don't forget this, because this is 100% question of your exam. There are other things that can happen within the medical field. When you make false statements about someone, think about this, whether verbally or you do it through words, but written words, like putting something, posting something on Instagram, WhatsApp, all these social media applications. Each one of them, you have a way of being accused of defamation. So when you make false statements about someone, whether verbally or by writing, guess what? We're going to have two terms that you need to understand here. So let's say that you start a rumor, a gossip about someone, and that's going to affect the person's reputation. But if you do it in a way of written libel, written statement, you wrote on Facebook, whatever this may be, and that also include pictures. You post some pictures about someone, you don't have to say anything, because the picture tells more than 1,000 words, right? About someone, immediately that is called defamation. Now, if it is orally, you are saying, you're spreading rumors, talking bad about someone, that is called slander. So slander means that you are making false statements orally. So you are telling someone. The other one is a written statement, including pictures, remember, images, anything that has to be written. It's not your words. Those words are translated into words. So that is written statements. So know these two terms. What is libel and what is slander? So that's the thing that you need to understand. One of the ways that I remember this, because remember, there is always a cue, a key for you to understand and remember those two. So think about slender starts with an S. So I remember speaking, speaking. Because when you see these two terms, you don't know which one is it. This is like assault and battery. You have both of them right there. This is new information for you. You don't know how to respond, how to select the correct answer. So when they tell you, okay, this is a false statement made using, some pictures, some written statements, what is called immediately, again, it's called libel. But if it is something that you are telling someone by spreading the rumors, you are talking about that person, that's called slander. Remember, speaking slander. That's how you're gonna remember. That's what I used to remember. So if I know slender speaking, I know that libel is gonna be whatever is left, right? Which is written statements. False imprisonment. Now, this is not sending someone to jail forcibly. No, that's not what I'm talking about. False imprisonment is when you are illegally, unlawfully restrain a patient. Let's put it this way, just a patient, because they're not about an employee being retained. It's the patient. So let me give you samples so you can understand what I'm talking about. So you're working with the patient, and the patient is very combative. And then you restrain the patient. You ask someone to hold the patient. Oh, no, no, can you hold this person while I'm doing this procedure? And the person doesn't want to. So you're forcing them. You're not only being accused of battery, but false imprisonment. This happens a lot, more than you think, particularly with the elderly. Patients are, a little demented. They have dementia. They don't recall certain things. Now you're going to force them to do something by restraining them, by placing them inside the bathroom. Oh, if you're not behaving, guess what? Like a little kid. I'm not going to give you time out. I'm going to put you inside the bathroom. Or the room where they sleep. I'm going to lock your room. You're not going to be able to get off from here. That is false imprisonment. So restraining the patient, remember, without the patient's authorization, you are committing false imprisonment. So remember the examples that I gave you, because those are the ones that are going to come out on your exam. You place the patient inside the bathroom because they don't want to do a procedure, or you restrain the patient without the doctor's authorization. In order for you to restrain a patient, you have to have a doctor's written order stating you can restrain this patient, and the way that you will use, what method of the restraint you're going to use in this patient. Other than that, you cannot restrain a patient. You cannot lock the patient inside the bathroom, inside the room. Not at all. It's unacceptable. It's illegal. That's false imprisonment. We talked about fraud yesterday. What is fraud? Wrongful or criminal deception. Remember, this is unintentional deception intended, remember, to gain financial, personal gain. So that is fraud. So one of the most common cases for fraud is filing looking for a reimbursement through the insurance company for services that you did not provide. Did not provide means you are charging more for a service, or you actually didn't provide that service, but you said that you did. So again, that is fraud. This is very common question. Remember, fraud, bartering, one of these types of defamation. They can use both. So what is libel, what is slander, you need to know. And they're going to tell you, you don't have to say, oh my God, are they asking me about defamation or what is it? No, they're going to tell you, okay, a false statement, a written false statement to damage the reputation of your coworker. What is called? It's written libel. But if it is an orally statement, so you're saying the things, you're kind of spreading the word, gossiping, and that's going to damage the reputation of the person that you are talking about, then that is going to be slander. So those are the things that I want you to remember. And because the exam is not going to be tomorrow, you got to highlight it. You got it, write it down, put a mark right there in your notes. And when you're going to review for the exam, you're going to take in consideration all the things that I'm telling you. Because you might remember now, tomorrow, a day after that we start covering other chapters, other material, you're going to forget. I remember most of these things because I've been practicing this and teaching these classes over and over and over for you as well. I should remember them. But for you, that you're the first time that you're encountering this information, it's not that easy for you to retain it. So that's what we have, all these materials right here that you can go and use as a reference later on when you need it. Okay, so any questions about torts? Non-intentional and intentional. Remember, the most common torts are non-intentional, because most of the things that we are sued as medical providers or the hospitals as a whole is because something was done unintentionally. You do not harm the patient on purpose. That usually doesn't happen. So for that reason, the most common tort is non-intentional. So negligence, malpractice, non-intentional. Assault, battery, those are intentional. False imprisonment is intentional. Fraud is intentional. Invasion of privacy is intentional. So what is invasion of privacy? You are not protecting the dignity of the patient or the medical information from the patient. It's not that you're releasing the information, because that's a different thing. That is confidentiality. You leave the medical record untended. You leave it in a desk where other people can open the medical record from someone else and read the information inside. That is invasion of privacy. You have electronic medical records, and you have the screen of your computer facing the waiting area, or allowing someone else who's not involved in the care of the patient to read somebody else's information. That is invasion of privacy. You do not close the doors when the patient is changing or you're doing a procedure. Somebody else can see what's going on. Passers-by, other patients. That's invasion of privacy. So that's basically, so we have to really, really be careful with the information of our patients and our patients as well. Not exposing them unnecessarily to the eyes of someone else who is not the person who's taking care of the patient. Or You're asking the patient to remove all the clothes when it's not necessary to do all that. So remember, you're violating the patient's privacy. Okay, so next, the Good Samaritan Act. Once again, we go over these terms because these are common questions for exam. So what is the Good Samaritan Act? This is an act that protects. This is in simple words. This is an act that protects non-professionals and professionals when they assist someone, when they render first aid to someone in an emergency situation. That's basically what it is. What is this act? Why did they come out with this act? Because many people do not dare themselves to assist someone in an emergency situations because the fear that something might go wrong and you are going to be found liable. So with this Good Samaritan law, we are protected. So let's say that you're walking down on the streets, you are the train station, anywhere, in a mall, in the parking lot, and someone collapses. You go there and you try to render services. Now, one of the things that you have to understand is if you dare to assist someone, it has to be within your limitations. What is it that you know about whatever you're going to do? So you're not going to go and start doing CPR on a patient and you don't know what is CPR. No, what you can do is call 911 and stay there until the ambulance or the fire department or the police arrives. Now you tell them what you saw, what you did to the particular person. So if you don't know, you're not going to be doing anything because that can cause more harm to the patient. But if you know how to do it, this is like within your scope of duties, so to speak, then you can assist someone. Or you call the dispatcher because when you call 911 to report an emergency situation, they're going to ask you questions. So you got to be ready to answer and to spend time over there. And because this law is going to protect you, so I'm going to do my best. So let's say that I'm a layman person. I don't have no medical background. Walking down the street, person collapses. I call 911 because I don't know what to do. I want the ambulance to come over. So the person who answers the phone is going to ask you questions. You're going to tell them, oh, I need an ambulance right here. And okay, where are you located? So you're going to give exact location of the incident. You're going to tell who you are, of course. They're going to ask you, who is the person? How many people is involved? Only one, male, female, male, female. More likely, how old do you think that the person is? If the person is not talking, then you assume more likely how old might be the person. You know if it is a very young person, an adult, an elderly. So you're going to describe all the information that the dispatcher is going to ask you. So you got to respond to some of the questions. And when the dispatcher is doing this, already getting someone on the way. So they got to be prepared. What is it that we're going to need when we arrive there? Who needs what? So they have to bring the person that is qualified to assist this patient, the materials, the supplies, medications, whatever the case may be. So for that reason, we got to be on the phone. If you have to give CPR and you don't know how to do it, they are going to instruct you what to do. If somebody's bleeding, they're going to instruct you what to do. Anything, they're going to ask you, okay, is the person bleeding? Can you see blood? Is the person conscious? Is the person breathing? Do this. Everything you do, if something happens to the patient, you will not be found liable. So this law protects you. That's what is called the Good Samaritan law or the Good Samaritan Act. So that's basically what it is. So remember, whenever you do something, it's because you know what to do. Otherwise, somebody is guiding you, and that person is going to be someone from the dispatcher's office, the one that you call when you call 911. And you got to be there until professionals arrive. Now they will tell you, okay, you can go, or you have to come with us. So remember, people sometimes don't want to get involved. And if you don't know and you don't feel like you want to do it, it's better not to do it. But if you do something, you have to stay there. So again, you cannot say, okay, listen, by the way, I'm going to be late for work. I have an interview. Oh, I have to pick up my child. Well, you cannot leave. You have to stay there until the professional arrives and they get all the information from you. Now, free to go. If you don't do it, then you're going to be liable. See, that's the reason many people don't dare themselves to voluntarily help someone because of the implications that might have, particularly time that you have to stay there until the professionals arrive. Not just calling 911 and telling them, oh, in this place, someone got hit by a car or collapsed or something else. No, you have to be there until the professionals arrive. So for that reason, you will not be found liable. And that goes for a medical doctor, nurse, whoever is not on duty. Remember, if a medical provider is in a hospital, in the parking lot of the hospital, someone collapses, it's your duty to take care of these patients or this person. You are within your time frame of work and you're a professional, you have to do it. There is no Good Samaritan law for this. This is when you are in your off hours. I'm walking in Times Square. Somebody collapses. I'm a medical doctor, yes, but I'm not working. I'm not in my office hours. So if I want to help, it's up to me. If I don't want to help, just pass by. Just be one more of the bystanders. Do nothing. But if I want to do it, this law is going to protect me if something happened to the patient. Because remember, when something happened to the patient and somebody was there assisting, family members are going to try to sue. Oh, probably they didn't do what they're supposed to do. They killed the patient. Oh, they should have done something else. But we have this law that protects us. Remember, if the medical provider is working, it is within the time frame or your job. This is not for them. They're supposed to. Oh, I'm on my break. What the heck? Doesn't matter. If something happens, you were on your break, you go to the restaurant, and something happens over there, this is the time that you're still working. So you're supposed to help. Now, if you are off already from the day and you went to the restaurant, somebody collapsed, it's up to you if you want to help or not. If you help, this act or law will protect you. So not because I'm a medical doctor, I'm obliged on my off time to do something for someone. No, if I want to, because it is something from me, from my heart that I want to help someone, it's up to me. But if it doesn't, nothing is going to happen. I'm not going to be sued because, oh, it was a doctor there, I didn't do anything. No, I have the choice. But if I do on my off hours and something went wrong with the patient, the Good Samaritan law is going to protect me. Now, one of the keys for the Good Samaritan law is that you should receive no payment. You cannot say, oh, well, I helped the patient and then the family gave me a gift. They paid me something because I say that I'm not supposed to receive anything. If I receive something, I'm liable for that. So the Good Samaritan law does not apply. So remember, I should not accept payments of no type. Oh, it was a gift. There is no way, no gift, nothing. You should not take anything. because it was an act of compassion, care, voluntarily, not because you were going to get paid. Now you're liable if something happened to the patient. So be careful with that. Okay, let's see how these contracts apply in an emergency. Remember, an emergency outside the hospital, inside the hospital, we call it implied consent. Remember, it's an emergency if it was outside or the patient came to the emergency. We usually don't ask what happened, what's going on. The patient probably is unconscious. The patient is not responding. How I'm going to ask questions? So anytime that you have questions about patient being in the emergency, do not assume, oh, well, I've been in the emergency and I was talking and they asked me questions. So what is the right answer right here? If you're in emergency, the consent is implied. Period. Regardless where the emergency is at, outside, inside, outside on the streets, somewhere else, or in the emergency room. If it is an emergency, always consider the consent implied. Period. That's it. So you're going to have this question on your exam. You are the medical assistant. You are in the emergency. Oh, as soon as you see emergency, you know that they're going to ask you for what type of consent the patient is going to receive. They're going to tell you a lot of stuff. Oh, you are asked to do this, blah, 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 blah. Okay, what type of consent do you collect from these patients? It is implied. If it is an emergency, it is implied. That's it. Do not think about anything else. Because if you do, you're in trouble. One of the problems that we as adults encounter when we're taking a test or when we ask questions is that we answer things based on our experience. And that is not right. Not all the time. See, have you encountered yourself sometimes reading something and then immediately your mind goes back to something that you have experienced before, and then you say, oh, by the way, I know this. I went to the hospital and I saw this. I went to the supermarket and I saw this. So you relate those experiences with whatever question they're asking you. But that doesn't apply. An exam is like a perfect world. It's a perfect answer. If I'm asking you about emergency, you need to know what is an emergency. And I already told you, an emergency is a life or death situation. The patient cannot respond to questions. How am I going to ask questions? We assume that everything that happens in emergency is implied. We are going to use an implied consent. We're going to try to save this person's life. Then, after we kind of, stabilize the patient, now we can ask questions. Now a family member probably is going to show up. Now we're going to ask the bystander, someone who knows the patient. Now it's a different issue, but we're not asking the patient. So the patient is the one that we're going to use an implied consent, not the relative, not the friend, not the family. So bottom line, when you talk about emergencies and you have questions in your exam about emergencies, about contracts during emergency situations, it's implied. That is it. So don't forget that. It doesn't matter how much stuff is written on the question. Emergency, implied consent. Any questions about express or informed consent? Now, I discussed this already. Remember, some of the information overlaps. So now here is where you actually write down. Now is when you explain the patient what's going to happen to this particular procedure. I'm going to tell you what is the procedure all about, Who is going to do it? Who else is going to work with the medical doctor that's going to do this procedure? What are the risks of doing the procedure? What are the benefits of doing the procedure? There are other options instead of doing this particular procedure. Can we do something else instead? So if you tell me everything about the procedure, the pros and the cons, that is called an express or informed consent. So usually we talk about informed consent because we are informing you. See, informing you about all the details about the procedure. Then the patient agrees or disagrees. Remember, this is someone who is conscious. This is someone who is mentally capacitated. How can we do this with someone who is an emergency? No, it won't be the case. So that's basically what it is. So for anything that the patient want to go through and the patient is competent, can respond to questions and things like that, then we're going to go through this. Remember, emergency situations, totally different. You have to use imply. Any other circumstances, informed consent. It's a written document where the patient has to sign whether agree or not. Okay, any questions about imply or express or informed consent? Remember, you're gonna be, those are 100% questions in your exam. What is imply? What is informed consent? Usually they don't use express, use informed. Let's go over the risk management. So risk management is a department within any organization. And what is the purpose of this risk management in the medical field? To avoid lawsuits. So it's going to be a group of people over there who's going to come out with some policies. And they're going to say, hey, we got to follow these policies if we don't want to be sued in our hospital. And these are common sense things. So reasons why the patient sued us. Not only because of a wrongdoing, it's because money. They want money regardless. So what is it that we have to do to avoid that this happens, that the patient or the family of the patient sued us for money? We got to listen to the concerns or complaints that the patient made. See, the patient is complaining about things, complaining about the people that works over there, that they do not care, that they didn't call them to remind them that they have a procedure. I was given this appointment 2 months ago. How am I going to remember 2 months ago and now I forgot to go to do the appointment? Yeah, it's our responsibility as patients, but not everybody is on top of that. Remember, I already mentioned it to you. You're learning these medical terms, these lectures. How you gonna remember a week from now? Well, how you gonna expect the patient to remember an appointment that it was given a month ago? I don't even remember what I did yesterday. And it's not that I'm mentally incapacitated. No, we are adults. And when we are adults, we have other things in our minds and we forget. For that reason, we have to contact the patients before 24 hours prior to the appointment, prior to the procedure, prior to the referral. We have to contact the patients to let them know that there is something pending. Why? Because probably they've forgotten. So if a patient complains about something about the office, we need to take it seriously. So if we don't, this is one of the reasons why they're going to sue us. Next, documentation. We talked about this yesterday. Remember, if you do not document whatever interactions we have with the patient in the patient's medical record, guess what? In the court of law, we don't have proofs. So we have to document, and when we document, has to be accurately, has to be the truth. We cannot make something up. And it has to be on time during the visit before we forget. Anything that we do has to be within our scope of training. Remember, if you do a procedure, has to be a procedure that is past part of your scope of duty. That's part of your training. It's something that you already know how to do it. We have to keep the patient's information confidential. Breach the confidentiality brings a lawsuit. That is it. All of these are reasons for you to be sued. Follow-up test results received in a timely manner. Now, again, me as a medical provider, I receive the lab results from my patient, whether they are negative or positive, but if it is positive, I have to contact my patient immediately because now I have to figure it out. What is the next step to correct that problem? But if we don't do it and something happened to the patient, we get hit with a lawsuit. And it's not just the medical doctor. Remember, it's your obligation as a medical assistant because you sometimes you're gonna receive, copies from the lab results directly from the lab, and you are the one who has to open those envelopes, put these results on the patient's incoming lab results so the medical doctor can read it, can review it, and take action, which is contact the patient and do due diligence, meaning whatever is next, what's the next step to correct that problem. Treat all patients equally and with respect. Now, when we said equally, depends of how the patients are presenting themselves. If someone is mentally incapacitated, you're not going to be treating them the same way as someone who is mentally competent. But yes, you're going to treat all the mentally ill people in the same fashion. That's what it's trying to tell you there. All patients needs to be treated with respect, regardless, race, sexual orientation, you name it, disabilities. Again, we've been saying this all the time. Why? Because these are the type of questions that you can get on your exam. Chart missed appointments or conversations as appropriate. That's lack of documentation. Remember, if a patient did not show up to the appointment, we have to write it down. It was a cancellation or it was a no-show. And we have to document that we contacted the patient because otherwise we're going to accuse by abandonment, remember, and offer the patient to reschedule. Remember, we should not tell or ask the patient, why did you miss the appointment? Why is it that you're missing your appointments all the time? That's not our job. Our job is to reschedule. Oh, hi, Mr. and Mrs. Brown. We're going to reschedule you, okay? Is tomorrow okay? We have available Monday and Friday, Wednesday and Thursday this week. Oh, let me check. From this time to this time. Can I sign you for this one? And the patient saying yes, you're gonna document it, the date, the time, the reschedule appointment. And if the patient doesn't show up again, you're gonna do the same again, and then you notify your doctor that this is going on, and it's going on frequently. The doctor is gonna know because the doctor is expecting the patient did not show up. We have to take measurements. And that's when we decide to withdraw the patient services. Again, this is very important. Review records with physician before copying. Now, this is not as simple as it may sound. This what it means is if the patient asks for a copy or their medical records or the lab results or any part of the medical records, the patient had the right to get the copy. But by no means you should do it upon yourself. Let me explain it to you. You are the medical assistant. A patient comes in and sees the doctor, and then at the end, the patient is going to make an appointment to follow up, or the patient is going to go because the doctor says, oh, well, we'll let you know if something shows up on your exam so you can, make an appointment. The doctor was not giving an appointment, or the doctor gave an appointment to the patient independently of that. The patient is going to say, oh, by the way, can I have a copy of the lab results? And you say, oh, sure, not a problem, because you are so good, right? And you're going to go and make an appointment, make a copy of the lab results without the doctor's authorization, you're in trouble. You're in trouble. Even though if it is the patient. Oh, can you make the copy of the last, visit that I have here? I need to show someone what is it that the doctor did, because I cannot remember all the things he told me. Oh, sure, not a problem. I'm not going to make a copy of that. No, by no means. Immediately, patients ask you about that and said, sure, let me talk to the doctor, okay? And you go and tell the doctor immediately, I have Mr. and Mrs. Brown. You just saw the patient. Was giving the patient an appointment, or the patient was on her way out, and she asked me for a copy of the blood results. The doctor is going to say, no. The doctor is going to say, bring the patient right here. I'm going to discuss with the patient. Or the doctor is going to say, that's okay. You can give a copy. You should not release anything from the patient without authorization from the patient. If it is to someone else, not the patient, but if it is the patient, you should not give anything to the patient either, just because the patient requested for. No, you have to talk to the physician. And the physician is going to tell you yes or no. And the physician is not going to say like, no. The physician is going to say, ask the patient to come back to me. Bring the patient to my office. And the doctor is going to talk to the patient and is going to explain whatever the patient needs to know. Then they will decide, and the doctor has to give you the authorization to make copies in what part of the medical records you need to make copies. You can't just make copies on your own. Oh my God, let's give copies because this patient is giving me a hard time. No, the patients themselves can sue us for violation of confidentiality. Yes, it happens a lot. Because they bring these results to someone else, someone else is going to tell them, oh, wow, do you notice that they didn't do this, or they do this wrongly? You can sue the doctor. No, they're going to sue the doctor because we committed all these issues. So again, you have to be very careful with the information that you have from your patient. This is not simple. This is not like this is the patient medical record. So now, hey, it doesn't matter. The patient is asking for it, so we're going to give it to them. No, you cannot. You have to ask the doctor. And if the doctor authorizes you, the doctor is going to tell you, make this copy. Now we have electronic medical records. The doctor is going to print them out. It's going to give it to the patient after they discuss with them. And the doctor exactly choose which parts of the medical record they're going to give it to the patient if the patient needs more than lab results. So it's not our job to decide what copies we're going to give to the doctor, to the patient. So remember, just because you're the patient and you are the one who requesting for, it doesn't matter. You have to sign a paper too. Because this information that the patient takes from the office can be given to someone else, and that person evaluates that and it can say, oh, well, they're not following the proper procedures. You can sue this doctor. They can come right away and sue us. So when we start covering medical records, which is going to be the next module, we're going to talk about the procedures for this release of information format. What information should be released to the patient? To who? What is the reason? Remember, it's not what the patient wanted and you're just going to give it to them. It doesn't work that way because the medical record do not belong to the patient, belongs to the practice, belongs to the medical doctor who create this medical record. So for that reason, you can kind of take, the responsibility to just release it. That doesn't work that way. Any questions about how to prevent lawsuits? Remember, communication, be nice to your patient, be nice to your patient, care about them. Patient who's satisfied, patient who had good experiences in your practice, usually they do not sue the office. It is 100% proven. How can you attack someone who's nice to you? Tell me. But if you're rude to me, you're careless, you don't care about me, and whenever I complain about something, you don't listen, and I keep on encountering the same issues over and over, well, as soon as I have the opportunity, I'm going to hit you where it hurts the most. I'm going to sue you. That's how it is. That's reality. And we're going to be there to prevent all this. Okay, last but not least, let's talk about these American Associations of the Medical Assistants Code of Ethics. Remember, the medical doctors have a code of ethics. Well, everybody has a code of ethics in the medical field. Well, medical assistants are not the exception, right? So what is it that you have to be abide by this code of ethics? So you're going to render services with full respect to the dignity of your patients or your human beings, right? So that is basically what it is. We have to do our best for the person that we are taking care of. And how do we are going to protect dignity? Remember, not exposing the patient's information, not exposing the patients physically. We don't want to embarrass them. We don't want to ask things in front of the people because people are going to be paying attention. What is it that you are talking? What is it that you're discussing? What's the problem that the patient has? Because they're not violating the patient's privacy, confidentiality. That's basically what it is. So you have to uphold the honor and principles of the profession and accept it is disciplines. Well, that means that kind of you taking the oath for, practicing as a medical assistant. You took this course, you learn some of the things that you are going to be considering like part of your scope of duty, and that's what you're going to be doing. You're going to be always doing that. You're not going to go above what you learned, below what you were trained for. That's basically what it is. You're going to continue to improve your knowledge. Remember, medicine, just like anything else, is moving. It's not staying still. Everything is evolving. So you have to be on top of everything, all the changes. If something has changed in your profession, you should be familiar with. So not long ago, we didn't have electronic medical records. Everything was written down on a piece of paper. Now we have to enter information in a computer. Now you have an account. Now you have a login and a passcode. You have to respect that. That's basically what it is. And every single time that you enter the system or you handling the patient's personal information, you got to make sure that you're going to handle this information with privacy and confidentiality. You can participate in services activities or service activities for the community. Well, this is up to you. If you have some time, you can volunteer in these events that they do for your community, for the elderly. So if there is any, you can volunteer for it. It's not an obligation, but it is part of your core of the code of ethics. So that's basically what it is. But the most important thing right here is have, compassion, has patience, have, be empathetic with whatever the patient is going through, keeping the patient's privacy and confidentiality with the information. That's basically what it is. So that is the AAMA. Remember, A stands for the American Associations for the Medical Assistants Code of Ethics. So that's basically what it is. So you have to do everything that it is in your power to the health of your patients, even in your field. Okay. Any questions before we move to the next chapter? So we're done with this chapter. So let's move to the next chapter. Oh, what is my other chapter right here? Oh, it is right. Oh, wow. Mhm. Okay, let's talk about these public duties of the physician. This is just the job of the medical providers, physicians. No one else can do this. No nurse, no medical assistant, no physical therapist, no PA, no nurse practitioner. Well, they have certain rights, but let's put it as the physician. Whoever diagnoses is entitled to do this. And who is it that diagnoses patients? Medical providers. So with the new profession, well, not so new, but medical physician's assistants, now they call physicians associated. And the nurse practitioners, well, they actually can do this, but it is mostly for medical doctors, medical physicians. So what are the duties of a medical physician? According to, certain situations, which is disclose some information, you are going to report certain events to the CDC and the World Health Organization, which is WHO. So this is what it is. Public health records and vital statistics. So what happened to medical conditions that we encounter that can cause risk to population? So that's basically what it is. When we diagnose our patients with conditions that can cause a risk, like communicable diseases, abuse of any kind, any types of abuse, we're going to talk about that. Most of the medical conditions, no. Certain medical conditions, we are going to, have the responsibility to report this. Remember, to the CDC, to the government. But which branches of the government? CDC. What CDC stands for? Centers for Disease Control. And WHO, what WHO stands for? World Health Organization. So we reported to the CDC reports to WHO. So that's basically what it is. It's a mandate. It has to be that way. It says right here, it's the public duty of physicians to report viral events. What is viral? Live events. And we're going to see what are those live events and communicable diseases and other type of diseases. How it's going to be done and what is going to be reported, we're going to discuss. Remember, medical assistants, nurses, no one who do not diagnose the patient should do this. Only the patient, only the medical provider who diagnoses the patient, who knows the condition, who encountered that situation where the patient came for assistance, is the one that should be reporting this. Failure to report this is going to get you in trouble. So you have to report it. We're going to see what is it that we have to report, to who, and when, and what details we have to give. Births. When we have a newborn in our hospital, clinic, wherever the case may be, here within the 51 states of the US, we have to report every birth, whether it's a live birth or stillbirth. We have to report it. We have to. So the physician who delivers the baby usually is an obstetrician. In the case that, you know, the mother was in a hospital. So once again, has to report the baby's birth. And he has to file a certificate with the county clerk's office on that particular state when the birth took place. So you have to follow a bunch of things. We're not going to go through every single detail because that do not pertain to us. But this is something that is a responsibility of reporting. That's what we have statistics. We know how many babies were born this day, this month, this year, in this town, in this county, in this state, in this country. That's how we know. Because we need to know it was a boy, it was a girl, it was alive, or it was dead at the time of birth. That's called stillbirth. So again, we have to report all of that with all the details. There is a format to do that. We're not going to go over all the things that requires. This is a birth certificate. Remember, it's going to be the information from the mother, from the father, all the information, personal information. Personal education levels, you know, job, profession. What is it that they do? And the child, well, we're going to have the child's name because usually before the baby is born, the mother already have a name for the child. So we're going to do all that because we have to request for a social security number for this child, new child. So that's basically what it is. So we're not going to go through every single detail. It's going to be all the questions about the mother, the father. If we have information on the father, if we don't, it doesn't matter. The mother is the most important part because it's the one that delivered the baby. Again, this is the format. If you want to read it, it's up to you. Other than that, just you need to know that physicians are supposed to be reporting every single child that is born, whether it was a living child or it was stillborn. The opposite is also true. Every single death in this country has to be reported. The same as the newborn, we're gonna report the death. Who was it? It was a male, it was a female, what is the age? What was the condition that died from? Where the patient died? In which location? At what age? So all those things are going to be asked. Simple. Also, if it was female, we need to report whether the female that passed away was pregnant or not. Because remember, pregnant females, sometimes they die during childbirth or provoke abortion or a trauma. Another thing that we have to report whether an autopsy, which is actually called necropsy, was done. So a necropsy or an autopsy is a procedure that is done to the dead body to determine the cause of death. Is it required for every single patient? No. We're going to discuss that later on in this chapter. When an autopsy or a necropsy is required. So this type of procedures is not done for every single patient. You have to meet certain criteria. The way that you die, that requires or not a autopsy or necropsy. So we have to report births, deaths. Again, where, what state, what town, what date, at which hospital, at which institution, where did the patient die? It was at home, it was in one of the medical institutions, what condition the patient has. Or it was killed, well, we're gonna see that. But the patient is dead, so what we're reporting is that, plus all the information regarding the death of the patient, because we need to report it. That's what we know, how many patients, how many people have died with this particular town, this particular county, this particular state, this particular country. Every single state reported to the state. Every single county, every single town reported to the state. And the state reported to the CDC, which is a federal organization. And the CDC reports this to WHO, which is a global international. That's what we know, how many people is living actually in Canada, in Egypt, and all these countries. How many people have died? We can go and we can find out. They're not gonna say the name of the person because that's private. They're just gonna let us know, oh, there were 10,000 births this month or this day, this year, in this place. This many deaths. But they're not gonna mention not names or anything like that because then will be violation of the privacy. Now, here is when we are going to explain whether this death was natural death, it was somebody who dies in a hospital, somebody who dies at home in any medical facility, but under which circumstances. So it's going to be an investigation. So if the patient dies under the supervision, under the care of a medical provider, there is not going to be investigation. So you were brought to the emergency and you die at the emergency and there were these medical providers taking care of you. Do we have to have a coroner there? Do we have to have a medical examiner? No. Only when there is a suspicious of some type of crime, some wrongdoing, We don't know how this person, why this person died, because he didn't die at the hospital where he was taken care of. So there is no need to involve other people. Remember, the coroner is the person who's going to investigate. It's going to gather all these proofs, all these situations to see what happened to the patient. Because we need to know whether this was a violent crime involved, or the patient committed suicide, or anything else. Somebody killed the patient, or the patient killed himself. So then we're going to investigate. That's when the medical examiner comes to play, because the medical examiner not only going to do the investigation based on all this information collected by the coroner, but now this is the one that is going to perform the autopsy or necropsy to find out what was the cause of death. That's basically what it is. They're going to take, they're going to open up the body and they're going to check every single organ. They're going to send for evaluations if they found something suspicious. They're going to check your blood to see if there is any toxins in there. If you were shot with a bullet, well, we got to find the bullet, or you will stop. We're going to figure it out what happened. It's not that we're going to figure it out who killed it. No, that's not their job of the medical professionals. It's what causes the death of the patient. Because that's what has to be written on the death certificate. What was the cause of the death? Natural causes. Unknown. It was shot. It was an infection. It was a car accident. It was a homicide. It was a suicide. That's what is going to be written on the death certificate. So for that reason, it has to go through all these processes. Now, if the patient, if the family of the patient wants the medical examiner to do a necropsy or autopsy on a patient who just died of natural causes, it is up to them. They have to pay for it, and they're just going to do it. But it is mandatory when there is a suspicion that something happened to the patient. It was not a natural cause. Patient has diabetes, have high blood pressure, he died from all these conditions. Do we have to do necropsy? No. But if it's not, this patient is not under the care of a medical doctor. Let's say patient is in a nursing home. They're going to investigate. If the patient died at home, they're going to investigate. The patient died outside of home, not in a hospital, they're going to investigate. And they're going to follow all these. The key right there is, what is it that we are going to report? But you need to know why it's all being done. They're not going to ask you about this, just for you to know. Medical examiner cases. Now, when is the medical examiner, called? Remember, if there's a suspicious death, then the coroner and the medical examiner are going to come to play. We are doing an investigation about, I explained it to you, if it is a violent in nature. See, that's when the coroner and the medical examiner going to intervene. Homicide, suicide, accident. I mentioned that. Caused by a criminal abortion. Criminal abortion is that you wanted to have an abortion. This is not something that happens because you fall, because you have trauma. No, you actually are causing this. And probably during this, you die. Related to contagious or virulent disease. Most of the cases that we don't know where coming from, we need to investigate. You went to, let's say, a foreign country and you came back and you got some type of communicable diseases over there, and you came here and you died. So we need to know what is it. What is it that you died from? Because we need to write down on this death certificate where you died from. And to protect other people, remember that might be in contact with this person to prevent other people from dying from the condition spreading around. If you are in jail, you are a prisoner, and you die over there, we have to investigate because probably you were killed or you killed yourself. Either or. But we got to find out. Probably it's natural causes, but we need to figure it out. If something resulted in an unexplained or unexpected cause, we just don't know. Remember, it's suspicious. You die and we don't know how that happened. Wow, this person looks so healthy. Never complain about anything. Suddenly, patient is dead. Remember, you are not in the care of medical doctor in a hospital at the moment of death. We need to investigate. Now you got electrocuted. You got exposed to radiation or any other type of injury with chemicals, fire, anything. We need to investigate. Because probably it was caused by someone else. Remember, people just have been killed because they start a fire in your home on purpose. They throw some gasoline, some electrical damage, an explosion, who knows? So we need to investigate how you died. And that's what we're going to report. So we need to know how many people died from electrocution, radiation, chemical injuries, suicide, accidents. And when someone dies, immediately we see, when we watch the news, we see that they say, oh, this person got, into a car accident. That is the cause of the death. This person committed suicide by doing this, by doing that. They killed themselves by shooting themselves, stabbing themselves, taking some chemicals, medications, poison, whatever they can, maybe hanging themselves, throwing themselves from the bridge or else. So everything is going to be documented, the cause of death. So that's basically what it is. Okay, so it says right here, legal investigations for medical examiners occur in cases suspicious of death. We've been talking about all the time. Investigation is required if death is caused by the following again. This is continuation. Or a person who have no physician in attendance within 36 hours of death. I mentioned it already. If you are in a medical setting, you're going to have someone checking you out at least every 12 hours, every time that we change shifts. So, but if you were discharged from the hospital and within 36 hours, patient dies, we're going to do investigation. So again, if a body, they found a body, and it's not claimed by family members, someone that they know, then we are going to do investigation. We are going to do an autopsy on this patient because we need to know, well, we found this body. We need to, try to figure out how this patient died. Of a child under age of 2 if death is from unknown causes. This is a child, this is a little kid who is under 2 years old. I believe that it doesn't apply for under 2 years. If it is a minor, it was dead, and we don't know what happened. It was not an accident. It was not this or that. Well, we're going to investigate to see exactly what happened. Probably was abuse. When we have someone who we do not know his or her identity, we found a body, we don't know who that is, and nobody knows. We gotta do an autopsy, necropsy. Remember, we're gonna examine, DNA. We're gonna examine fingerprints. We are going to do, whatever other things, maybe checking DNA from bones, if it was remains that were found. So whatever they have available over there to identify the person. So that's basically what it is. So they have to do this autopsy because we need to identify who's the person behind this body or these remains of the body. This is very important. Communicable diseases. Now, what is a communicable disease? As the word implies, communicable means that it communicates. Just think about that. It commutes, communicates, it travels, it is passed from one person to the other. How so? If you have a condition that it is communicable, means that might be a virus, might be a bacterial infection. Remember, like COVID-19, like sexually transmitted diseases, syphilis, gonorrhea, chlamydia, hepatitis B, hepatitis C, HIV, a lot of stuff. Or other types of hepatitis, chickenpox. All these viral microorganisms that can be transmitted from one person to the next, that can cause not only a endemic, but a pandemic, which is the worst, because it can affect many people. So these are reportable because it affects the population. So we need to know how many people in this country were diagnosed with HIV, how many people with HIV became actually AIDS patients, how many people have hepatitis B, hepatitis C. So when you come to the doctor and we run all these laboratory testing and we diagnose you or the blood results are coming positive, immediately we report you. Remember, when we said we report you, we just report the condition. We are not mentioning your name because that will be a violation of your privacy and confidentiality. That's your personal protected information. We don't do that. So I have a patient who, I'm just giving you an example, I'm not going to tell you anything else. Let's say that I'm evaluating one of my patients. I ordered some testing, and it turns out that the patient came positive for gonorrhea, chlamydia. Okay, I'm going to give my patient treatment, but I'm going to report this case immediately. So we have a system in the computer that we enter and we report it. We're going to say, it's okay, today is the 13th of November. At this time, in this hospital, in this town, I diagnose a male, this age, without saying name, just male, age, ethnicity, where is the patient from? So again, race, everything. So we're gonna report that. So whatever the case may be, we're just going to report the condition and who got the condition without mentioning anything about the patient. We're not going to say, oh, this is a social security number. Well, because it's going to identify the patient, right? Oh, this is lives in this address. No, we don't do that. We just report the condition and who developed the condition. It's like when we report a child, a newborn, a dead person. We're going to report the case itself without getting involved patients' protected information. We don't, because this is not the case. We're not trying to put you on the spot. And it says, oh, this Mr. Brown and Mrs. Brown living in this address got diagnosed with it. That's not how it works. That will be violation of HIPAA privacy rule. Not good. Any questions? AIDS patients. This is a particular situation because before I run these tests, I have to consent my patient. I mentioned this prior, so don't forget this. Sometimes it comes in exams, but sometimes it is important because if you're a medical assistant and you're going to be drawing blood, you have to have a consent from the doctor prior for you drawing the blood from the patient. You cannot just draw blood, or the doctor cannot order blood, and one of the tests is going to be HIV without consenting the patient. That's illegal. In other words, you go to your medical doctor. The medical doctor doesn't offer you HIV testing. We're talking about HIV, AIDS. You have to have HIV in order for you to have AIDS. But most of the time it's HIV because it's for us to detect through analysis of blood or some other body fluids, whether you have the virus, the HIV virus, or not. Now, again, you go to the doctor offer you, remember, offer you to do the test because of the circumstances, the chip complaint, because of the situation about all the symptoms that you have it. So if that might be something that I kind of consider as a medical provider, said, oh, probably this patient might have HIV because the signs and symptoms, who knows? So I'm going to make sure that I'm going to follow my scope of duty and I'm going to do everything possible to try to detect what's going on with my patient. So I offer my patient. You have to be offered. Mr. Brown, Mrs. Brown, I will suggest that you get an HIV test. Oh, no, I don't want to do it. Okay, not a problem. Sign that document that you don't want to do it, okay? I'm not going to force you. It's your right because it's the patient's rights. That's it. Patient cannot sue me if later on the patient develop HIV, then, found out, start passing the condition to someone else. You're a responsible patient. Not me, because I actually offer you the test. Now, this paper has to be with the medical records, within the medical records, and when they order a blood test and the doctor have already write down HIV, is because the doctor already consented the patient, not you. And you should not ask by no means, hi, I can see here that the medical doctor ordered HIV. Were you consented before? Because remember, according to my professor, you're supposed to have a consent before this. Your doctor, this is not our responsibility as a medical assistants. If the doctor orders something, it is the responsibility of the medical doctor. But you know already that in order for the doctor to use this, because these are going to be questions on the test. So the medical provider has to consent the patient when they order a test. I'm talking about HIV in this case. We do not consent the patient for glucose levels, cholesterol levels, protein levels, hormone levels. We do not. This is for special testing. Paternity exams, yes, we need consent because that's totally different. DNA, you need consent. You can't just be doing DNA in someone without the patient's consent. But we're talking about HIV here. Because these questions, once again, they show up on the exam. Which of the following laboratory testings, blood tests requires a consent form? Oh, HIV. That's it. Anything else is not. Because they're going to give you like cholesterol for diabetes or something else. No. Those do not require consent. Because this is reportable, not anything else. This is a communicable disease. We do report every single condition from our patients to the CDC, so we know how many diabetic patients do we have in this country, how many people have developed this type of cancer. We have to report it. But this has to be reported immediately because these are communicable diseases. Someone passes to the next, is going to cause a pandemic. So we don't want that because that can be preventable. That's the reason what it is. Diabetes is not transmitted like that. If you have diabetes, you're not going to be transmitted to someone else because you are close to them, because you are eating next to them, because you are using the utensils that they use, because you're sharing and you're kissing the person, because you're having sexual intimacy with them. No. It's not going to be that. So we need to understand exactly how this works. That's important. If you understand that, then it's going to be, it's going to be safe. All states require reports of these cases to local state Department of Health. Every single case about communicable diseases, particularly this one, because it has no cure. They're working on it, but it's not 100% yet. Now, who is going to report this? Medical physicians. It says laboratory. Now, when we talk about the laboratory, is the medical doctor, the microbiologist who did the test, who did the analysis, who's going to send me the results. That's the one. It's not the laboratory technician that is going to report it. No, it's the medical professionals. Whoever evaluates, analyze this test and says, oh, this patient does have, it is positive for this. Because remember, in the case of a patient who has been diagnosed with HIV, not only I'm going to report this to the CDC, but I have to tell the patient, remember, the patient signed a consent. And one of the things that I explain my patient during the consent is like, Mr. Mrs. Brown, you voluntarily accepted to get the HIV test. If your test comes positive, we are going to disclose, we want you to disclose this information to your partners, to the people that you got involved, sexually involved, of course. And if you don't do it, we're going to tell the people that we know about it, like your contact information, your wife, your husband, depends on who's the patient, or the person that you put as the immediate contact or emergency contact. So we explain the patient. That's what we need to get the consent from this person. Because later on, this patient cannot accuse us of disclosing the information by contacting the people that he's been in contact with and probably have sexual interactions with. It is our duty, it's our job to do that. We give you the choice to you first. And if you don't do it, we're going to take the issue in our hands. And that's legal. That's how it is. It's the law. Any questions about what is reportable, what needs consent? Because this is important. So every communicable disease, remember, anything that you hear that it says is a communicable disease, it is reportable. Now, conditions in general are reportable because we need to have statistics of who's sick of what, and the pharmaceutical companies are going to be working on medications to treat this particular condition because it's becoming very prevalent or very common, so to speak. That's how it works. So let's give you this scenario. You're working with the patient, you're drawing the patient's blood, you don't know anything about the patient, you have no idea about the medical conditions of the patient. Remember, when you're going to draw blood, you don't ask the patient, oh, by the way, do you have any communicable diseases that might be aware of? That's it. No, we never ask those things. We just do the blood, do our diligence, we follow all the steps, how to protect ourselves during the procedure. But if accidentally you kind of stick yourself with a needle that has been contaminated with somebody else's blood, by no means you can, as a medical assistant or lab technician or nurse, or a doctor who's not the doctor of the patient, cannot automatically say, oh, I'm going to collect a tube of blood and I'm going to send it for HIV. What if this patient has HIV? I need to know. So I'm going to order that. That's illegal. You will go to jail for that. So what you're going to do is you're going to complete this incident report. You're going to notify your supervisor, and they're going to give you a paper where you're going to write down briefly what happened. How did you stuck yourself with a needle? Where were you? What you were doing? Then the doctor is going to decide to read the medical record of the patient and to see if the patient has something. They cannot just automatically order a test to detect whether they have HIV or not, or hepatitis B, just to protect you. No, that's not how it works. That's illegal. I know someone who did that, lost license, got in trouble, had to pay a big, large sum of money. So be careful, because sometimes when we are in the laboratory, we think that we have control, but that's a no-no. We never add a test. As a medical assistant, you were ordered to draw these particular lab samples. That's all you're gonna do. You're not gonna add, you're not gonna remove. Oh, I think that this patient doesn't need this, or the patient doesn't want it, but I'm gonna convince, let's do only one tube, and the other ones, don't worry. No, that's not how it works. So you're gonna do everything that your doctor has ordered to do, right? If you don't do it, you have to notify the doctor. So again, this is not our decision. We cannot give orders. We do not decide what is done, what is not done. We just follow orders. Let's move on. What other things are reportable? Child abuse of any kind. So again, it's not that, oh, well, child abuse, if I see something, well, sometimes you're not going to be seeing physical abuse. It might be emotional abuse, might be psychological abuse. It might be false imprisonment. You're keeping the child just locked inside the room, not letting them go, not going to the school, not going anywhere. So you might not be able to see physical abuse. So again, you have to do your due diligence. You have to do your job. So that's basically what it is. So you're gonna get involved all, these medical providers that are, involved in this type of investigation, so to speak. So that's basically what it is. All abuse must be reported by teachers, health professionals, law enforcement, and daycare personnel. Social services workers are the one who needs to be notified. Many of the organizations, they have a social worker. Social worker is not just in medical setting. They are in big corporation that has nothing to do with the medical. Why? Because whatever problems the clients have, they're going to report it and they're going to go to social service or the social worker. Physicians have been held liable for not reporting cases. So if you do not report the cases, you're going to pay the price as a medical provider. Medical assistants do not report this. I'm telling you what happened to medical assistants. Sometimes you are the one who's going to be drawing blood from the child. You're going to do a particular procedure to the child. We have seen a lot in pediatrics. So let's say that you see bruises, some suspicious marks on the child when you unclothe the child. You do not tell the patient, oh, by the way, what is all these marks around here? Have you been abusing your child? That's a no-no. You're going to pretend that you did not see anything. You just disregard everything you see in front of the parents, the companions, whoever brings the child. You are going to excuse yourself, like nothing happens, and you pretend that you're going to do something and you're going to report it to a doctor, to a supervisor. And they're going to come, they're going to contact the police enforcement or the social worker. The medical doctor comes immediately. It's not when the patient is gone. No. So you have to report it if it is a visit that, the child was brought by the family member to the outpatient clinic and you notice something, you notice burns, you notice bruises, you notice, scars, you notice something, and that's going to be really, really red flag. But we do not do anything suspicious that might draw the patient to take the child, the parents to take the child away. So we have seen a lot of stuff with the child, with the elderly. If you report all these, we are protected by law. This is not violation of HIPAA, privacy, or confidentiality. No, by no means. We're trying to protect the life of this person that is being in that situation of abuse. For that reason, we are protected. Elder abuse, again, whether it's a child, whether it's an elderly, we're going to report anything. So includes physical abuse. Now, physical abuse is something that we're going to see. It's very obvious, remember. Fractures, bruises, burns, scars. We're going to see all that. Neglect. How are we going to see neglect? Well, the child or the elderly is very skinny, malnutritious. We notice that it seems like it's not being eaten. Exploitation, meaning it's being used sexually. That's basically what it is. And it happens to children, happens to elderly. Abandonment, again, that's part of the neglect. You just don't care. You just leave them somewhere. You're not rendering the care that the patient needs. Financial abuse. This happens most of the time in nursing homes and home healthcare agents that steal the money from the patient because they are elderly, because they are mentally incompetent. Or when the patient comes to the office and they bring their belongings, they are admitted and somebody else takes their belongings, they steal them. So again, abuse can happen in many forms and shapes. So we have to report it. If we encounter these situations, remember, medical assistants, nurses, because sometimes you do procedures that we don't do, and you might expose the patient and you might see things. Do not question the parents or the companions or the guardians, whatever you're going to call. Just, keep it. And as soon as you have the opportunity, right there at the moment, you have to report it. One of the nurses, one that I was working with, and you have to be very discreet. That's what I'm telling you. She encountered in pediatrics one of the child that was abused have all these marks, bruises in the child's body. It was like 5 years old child. And she scooped right after saw that, scared, and left to look for someone to tell that. When we went back to the lab, when the patient was with the child, they were no longer there. Because you already told them what you said that you were going to do when you scoop out of the room, in shock about what you saw, instead of pretending that nothing happens, and you make excuses how to keep the patient with the companion there. So the authorities come over and arrest this person, ask the pertaining questions, do the investigation, do the due diligence, because that's the most important thing. So you have to be very discreet, because you're probably going to encounter one of these situations, whether with elderly. Don't assume anything. Never assume. Don't go there and say, oh my God, I encountered a child that's been abused. How do you know? Oh, I saw all these bruises. Because sometimes it's not. So it's something that you suspect. That's why you do not say anything to the patients or the companions. So you're going to go there and let professionals to intervene. That's it. So don't assume anything. Don't tell, oh, I see this, I know it. No, do never reassure something that you don't know about it, because it might be a miscommunication, misassumption. May not. There are some cases that it's not what it seems. So for that reason, we don't say anything to the patient, to the family of the patient. Spousal abuse. See, not long ago, partner spousal abuse was not part of the reportable things. So now we have a law that also protects the husband from being abused or the wife. Most of the time, it's the wife. I'm not saying that husbands or partners, males, are not abused. Not in the same amount or rate as, females. So you have to report it. We have a problem sometimes because when I was working in emergency, I have these patients that I have to evaluate because they were, they have all these injuries, face, nose, arms, legs, sometimes with fractures, sometimes with, sharps injury. We called the social services and they came to evaluate the patient, and the patient just didn't want to play charges. They didn't want to go anything against the person who was the perpetrator, but our job is to report it. If you don't want to do anything, it's up to you. Because this is not an elderly patient, it's not a child. But we report it. It's just that whether you want to take measurements and you can play charges, this is up to you. So we have lots of those in emergency. But our job is just to report the abuse. Whether you play charges or not against the abuser, up to you. I'm talking about spousal abuse. Because most of the time, they don't play charges. They don't play charges, unfortunately. So how the government or the law enforcement are gonna get up on these situations? Well, females, most of the cases, once again, that have been abused and they decide to, to take, measurements to prevent this. They are offered shelters, they are offered mothers, single mothers, or whatever else, assistance. And we sometimes, the law enforcement, now the law enforcement are going to issue a restraining order. So remember, what's a restraining order? Preventing the person who's being the perpetrator to get close to the person that is being violated within certain distance. They cannot communicate with them by any means. So that's basically what it is. So all depends, whether the person abuse want to play charges. But that's how it goes. Any questions? So this is how it works. Any questions? Because we have 7 right here. 7:06. Wow, time's go fast. So let's take a break. We return at 7:40. We cover the rest of the material and we're gonna go early. Okay, so 7:40, we return, we cover like 30 more minutes and then class dismiss. Got it?
Yes. Okay.
7:40 it is. See you then. All right. Enjoy your rest. Enjoy your break. That's what I mean. Okay, so I'm back. Let's continue with this chapter. Oops. Let's plug my computer. Oh, I don't want to forget it now. Okay, so any questions about what we have already covered? Child abuse, elderly abuse, spousal abuse, anything at all, communicable diseases. Okay, so then let's continue. Signs of abuse. I already mentioned some signs, but we're going to go over a bunch of signs that might be indicating that the person has been abused. So, repeated injuries. Family members bring the child very often to the medical doctor, to the emergency, claiming that the child fell, got injured by themselves. That is a sign of abuse. That is suspicious. So investigation needs to be started in these situations. So again, an elderly is all the time, showing signs of bruises, scars, falling all the time. So something might be happening. Again, if we don't have an explanation for them that makes sense, because remember, the parents or the guardians, they're going to come out with excuses how this injury occurred, but sometimes it doesn't make no sense. So we have to investigate. When something looks suspicious, remember, you have to bring it up to the professionals. We do not take the law in our hands. We communicate our suspicion to the medical provider or to the social worker in private. We never question the person who's taking care or the person that is being abused about the situation. We just report this to someone who has more authority, who knows what to do. Because remember, if we don't do that, then things can escalate or something worse can happen. Unexplained fractures. Again, unexplained bruises, scars. Okay, this is kind of very suspicious. So we need to report this. Bite marks. It happens. So who's doing this? That needs to be investigated. Again, if it is a child or it is an adult, including a spouse, can be beaten. And if that has health consequences and it's not being reported, we have to remember these people comes to the medical setting for help sometimes. And they don't tell the truth because they are afraid to tell the truth because the perpetrator, the abuser, might retaliate if you turn them in. So that's what you have to be very persuasive. Get someone who really knows what it's doing. Let someone who is a professional handle this situation. And, they can get to the bottom of the situation. We are not prepared for that as a medical assistants. So we delegate this to the experts. We just report this to someone else. If you have an elderly, a minor, anyone presenting with bruises, swelling in the genital areas, that's probably sexual abuse. Elderly, children, or someone who's mentally incapacitated with signs of malnutrition. You're not feeding them correctly. They are very skinny. They look pale. They've been losing weight. Probably it's time for the authorities to get involved. During sexual abuse, you can pass sexually transmitted diseases to the child, to the elderly. So again, we have to investigate. But somebody has to report this, someone who get, in contact with the situation, who encountered the situation, some might say, has to report it to higher authorities. You got to follow the chain of command, remember? So you're going to tell your supervisor, you're going to tell the medical doctor, the social worker, so they can do something. Remember, you're just suspicious about something. You're not confirming something because it might not be. It might not be what you're assuming it is. But you're not going to lose anything by reporting this. So again, sometimes you can have someone who's covering these injuries, particularly bruises, with makeup, just to cover up whatever, abuse you've been receiving. So we're just gonna be very vigilant with these situations without causing suspicion to the person who might be the perpetrator. So that's basically what we do. Most of the time, when the patient comes to us and we have the chance to see the patient, might not be obvious, might be hidden under the clothes. So if you do physical exam, if we notice something uncommon on the patient, we might order to do a test, and probably it's not necessary that requires to remove the clothes. And if the family member, if the person who's taking care of the minor or the elderly kind of refuses or says that it's not necessary to do this, probably they're hiding something. So again, that will be the job of a medical professional to order to do something. So we don't do it, we just report it. Remember, that's the most important thing. But be vigilant with any of these possible signs of abuse, because it's very important in the workplace. Substance abuse. Now, we are not talking about patients who have substance abuse directly. We're talking about people who works in the medical that might be abusing medications, or better yet, let's rewind a little bit. It can happen in both settings, or the medical provider is abusing medications that are supposed to be given to patients that are taking it, particularly these controlled substances, like level 2 medications, like morphine, codeine, or other medications that are used for, emotional, psychological conditions. So again, it can happen. Or the patient is asking for medications that are, usually causes the patient to get dependent on these medications, causes an addiction to these medications. Again, all these medications that contains codeine are very addictive medications. And people sometimes, they just come to the office and they request, oh, I have a pain, but I need this medication. They already tell you or tell us what they want. We immediately know that these are drug abusers, users. So that's basically what it is. So we have to be on the lookout of all these situations, whether the medical provider is using drugs, medicated drugs, because that happens a lot, or the patient is doing it. We have situations in which the patients request for a medication, but actually it's not for them. It's to sell it. And they sell at a very high price to the drug abusers. So we have to be on the lookout because these medications are paid by the insurance. And that is fraud. This is not something that they need for themselves and not something that is going to treat a medical condition. Instead, is to sell it. Again, that comes either way, or the medical doctors are prescribing this without realizing what's going on, or the patient is pretending to have something and the medical provider is just prescribing these medications. So it's either or. We're going to be taking care of, we're going to be on the lookout of this. Now, whenever you're going to present or report these cases, you need to have some type of evidence, right? So you have to document everything. The date of the visit, what you saw, what you found out, and if there is a case in which has been reported abuse, with this elderly abuse, child abuse, sexual abuse, well, we have to report it. We have to get the proofs. We have to order body fluids exams, evaluations. We have to do the physical exam. If it is sexual abuse, we're going to evaluate the patient genitalia, whether it's a male, whether it's a female. We're going to check them out to see if there is any evidence. Plus, we're going to collect body fluids from that area. Physically, you can notice when someone is being abused, whether vaginally abused, anal abuse, that can be seen during a physical exam. So we evaluate our patients more thoroughly just to make sure that we do not miss anything. And we collect, once again, body fluids to make sure that we have all the evidence possible to determine whether it was some type of abuse. Take pictures. So here is the evidence that we can collect, photos. So we take pictures of the patient's bruises, injuries, or the patient is just malnutritious. It is very pale, very skinny, not well groomed, the way that they dress, how they present themselves. Remember, someone who's being abused is not going to be in the best shape anyways. As I mentioned before, we're going to get, body fluids like urine, seminal fluid, vaginal fluid, blood. We got to make sure that we do our, due diligence, because other than that, we're probably going to miss something. Clothes, the way that they dress, or some stains of body fluids within the clothes, underwears, or clothes in general. So again, all this is required by law, so we can, proceed with the case, whatever the case may be. So there are so many ways that we can find out if the person is being abused. All depends on the type of abuse that we are suspecting the patient is being exposed to it. And all this information is gathered, in a professional way. Everything is documented. We have forms for all these, for views. Remember, it's the medical doctor's job to complete these forms, to do the evaluations, the physical and the laboratory procedures to determine whether something is or is not happening to the patient. Other reportable conditions. So now we're going to talk about these chronic conditions, because every single medical condition has to be reported. But this is not in the same level as we report communicable diseases, abuse. That is a little different because of the intrinsicies that, communicable disease presents, because this is something that can be passed from person to person. So we're going to avoid that. These other conditions, like chronic conditions, if they're not going to cause one patient to transmit this condition to the next one, well, we are not so worried. So we are not in a hurry to report this, but we can report it without much evidence. It's just saying lab results, because we have the lab results that proves that this patient has been diagnosed with diabetes, some biopsies that we have, the result that this patient have cancer of this type, or any other conditions with their pertaining evaluations and analysis. So we have to report it, because we need to remember, we must keep all the statistics. So every single condition that happens, to who happens, which population is being more affected for this type of cancer? Is it males? Is it females? What ethnicity? At which age? Which is the most prevalent type of cancer? What is the most common? See, when we talk about diabetes, we mentioned that type 2 diabetes is more common than type 1. So we have to report that. And that's the only way that we find out which one is more prevalent, is more common, so to speak. So that's basically what it is. So we're going to report every type of cancer. Remember that that's how we know which cancer is number 1, number 2, number 3, number 4, and so on and so forth. So which are the most lethal cancers? What cancers can be treated and kind of, have better outcomes than others? So we have to report every single time. Epilepsy. Remember, epilepsy is a neurological condition where something within the brain, something within the nerves is not working properly. It's like having a short circuit inside the brain with the nervous system. So every time that you have these convulsions is because something within the brain did not go well. So that's basically what it is. So these are these chronic convulsions due to malfunctioning of the nerves within the brain. Patient can die with convulsions, with epilepsy, any congenital disorders, anything that you were born with, like Bell's palsy. Paralysis, Down syndrome, autism. We have to report all those cases. Any condition, you name it, we have to report it, because we have to have statistics. We have to know how prevalent this condition is, how common these conditions are. And we're going to give this data to the pharmaceutical companies, to the manufacturer companies that, they built, manufacture these equipments that we're going to use to treat, to examine, to evaluate these patients. So we're going to share the information because if we have lots of patients who have this medical condition, well, we have to have medications, treatments for these patients. It's not the hospital that creates that. It's going to be another entity who's going to do that, who's going to create all these equipment. The hospital do not create EKG machines, blood pressure machines. They don't create MRIs, CAT scans, a sonogram machine. No, there is other organizations, but they create all these equipment based on demand, based on how many people suffer in that condition. Think about you opening a restaurant in an area where people will not buy your food or will not buy what you're selling. That wouldn't be a good business for the manufacturing companies or for the pharmaceutical companies, right? So they need to know what are the statistics. Is it worth it? Do I need to manufacture this particular equipment? Oh, it is only rarely found this condition. Oh, we're not gonna worry about getting medications for that because we're gonna spend a lot of money building, manufacturing all this, and that's a lot of costs. But there is no demand. What is the purpose? So that's how it is. So we have to report every single medical condition. But these communicable diseases has to be reported immediately. I got the test results, boom, I had to tell. The other conditions, we can treat it, then we report it because little changes can happen. The other one, we don't have time because it is a communicable disease. So that's basically what's needed. So we have to report every single situation that we encounter. We have to report it. Some of them we have to report it immediately. Some of them we can wait a little bit because we're doing all these procedures, all these evaluations and treating the patient and see how it develops. And if the condition becomes chronic, now we are going to report it. Whereas with communicable diseases, as soon as they appear, because they are short-lived, so they're not going to last too long, but they are going to be passed from one person to the next. That is the problem. Controlled substance. So here we have the organizations. We will be discussing this a little more during pharmacology, because we're going to have a module for pharmacology, medications. We're going to talk about all these types of medications, like, not going to be mentioned every single hypertension medication, every single type. No, that's not what I'm talking about. The types of medications, their classifications, which is the right word to use. I use the classifications of the medication. So that's basically, we're going to go very kind of basic, just for you to understand medications, but not much in depth. But all these medications are being monitored, if you will, by the Food and Drug Administration. Remember, the Food and Drug Administration of FDA, this is the organization that kind of monitors the pharmaceutical companies. So when they're going to come out with the medication, they are the one who approve or disapprove whether you can do the research, whether you can work on the medication, or whether you can bring this medication to the market or not. So they are the one who approve it. So that's basically the purpose of the FDA. And it's not only medications, it goes also for beauty cosmetics. That is also approved by the FDA. If it is not approved by the FDA and somebody's using those medications, those are illegal medications or cosmetics. Then you're not going to be abide by the law. Somebody's using medications or something that is not approved by the FDA. Well, what are you going to do? So again, there is not much investigation. You're just going to put these people in jail because that's illegal. Drug Enforcement Administration, DEA, this is the organization that authorizes, monitors, regulates these controlled substances, only for controlled substances. So a medical doctor, just because you're a medical doctor, does not imply that you can prescribe every single medication. No, it's not like that. So remember, just because I'm a medical doctor does not imply that I can perform in any of the specialties as a medical doctor. No, if I'm an emergency medical doctor, that's what I can do. Can I go do a surgical procedure? No. Can I be a psychiatrist? No. Can I be a pediatrician? No. Can I be a gastroenterologist? No, that's not my specialty. The same goes for medications. Can I prescribe every single medication out there? No. If I'm going to prescribe a controlled medication, which is controlled substance, I have to have a special registration, special license that is only for these particular medications. If I don't have it, I cannot prescribe those medications. So morphine, if I have a DDA license because I have to do these medications when I was in emergency. But a regular doctor, if it doesn't apply, because this is voluntarily, if I want to apply for this one, it's because I want to prescribe this type of medications. But these type of medications get you in trouble. For that reason, medical doctors, general medical doctors, don't want to get into this. Why? Because you're going to have these drug seekers coming to your office, and the only thing that they want is hydrocodone. They want codeine, anything that contains these medications. Then our excuse is, I'm sorry, I cannot prescribe that. They don't believe us because they don't know anything about the law. It's not that the doctor is saying no because they don't want or they can. It's because they don't have a license. I don't want a license because I don't want to prescribe these medications because these medications are going to get me in trouble. Someone who has a DEA, it is monitored by these Controlled Substances Act, the Drug Enforcement Administration. Every prescription that I write down to a patient, they're going to see it. This is like a camera that they put in my room, and they are monitoring every single movement that I do. So that's what they do. So who wants to be monitored for all these? If I don't need to, I can prescribe any other medications for diabetes, for cancer, for this, that doesn't have these narcotics kind of medications includes with. So that is the Drug Enforcement Administration. So every single prescription is going to have your license. It's not the doctor's license. I have a doctor's license. But the doctor license to practice medicine is not the same as having a Drug Enforcement Administration license. Remember, this is voluntary. If I want to prescribe those medications, it's voluntary. It doesn't cost me anything. I just apply. I give them all the information about my license as a medical doctor, and then they look through all the files, and they said, "Oh yeah, I can give this." I didn't have to apply. The hospital applied for me. But any doctor in their own offices, they can apply, and you can get it. But they are following every single moment, every prescription that you write down with narcotics, with this level 2, they know who's writing it, how many times you write it down. And if you go beyond what you're supposed to do or prescribing too much, They do an audit, they come to your office, they check everything, and they get you in trouble. We don't want that. So that's basically what it is. So there is another one that is called the Bureau of Narcotics and Dangerous Drugs. Now, this has to do with these illegal drugs. People who, use and abuse certain drugs. So again, that also includes level 2, because level 1 is illegal drugs. Illegal drugs like cocaine, crack, ecstasy, you name it. That will be included in that. Marijuana will be included in certain states, but now certain states is legal. They probably remove it already from this group of level 1. So that's how it goes. We have organizations who kind of, monitor everything that we do, depending, of the circumstances. So we will discuss a little more the levels or the medications, and you will learn the 5 levels and see which ones are the most restricted ones. And these medications are not medication that you're going to be prescribing. You don't give refills for these medications. Only the doctor can call the pharmacy and say, okay, I want you to give this medication. We cannot call, as medical assistants, we cannot call the pharmacy for refills or anything else. Not at all. We can call for diabetes medications, for arthritis medications, for cancer medications, for stomach, any other medication, not controlled substances. That is the job of the doctor. The doctor directly involved with the pharmacy. That's it. See, prescription or controlled drugs or controlled substances, that's what we call. Only those with a DEA number may issue prescription for narcotics. Now be careful, because narcotics are not these illegal. Narcotics are part of level 2 drugs. That's basically what it is. We have 5 levels. So we call it schedule. So we have schedule 2, that will be the levels, see? We have schedule 1, which is all these illegal drugs. And then we have 2, which are all these medications, all these medication that contains narcotics, meaning medication that make you addicted and that you want more and more and more. That's the problem. Anything else is going to be all the other medications for medical conditions, regular medical conditions. So that's basically what it is. So again, the doctor has to sign for this particular license. They have to apply. If you want it, if you don't want it, you don't need to apply. If you don't want it, if you're working in a hospital, the hospital applies for us. Then, if you will refuse to do it, then probably my job depends on giving these medications, and you don't refuse, then you will not have the job. But you have to control yourself when you prescribe this, and you have to be very discreet when you do this. So know the law. So that's basically what it is. And you are going to see in the prescription part of the order that the medical does to order these medications, you're going to see it says DEA number, and it's going to appear right there. So if I don't see DEA number and the stamp and your signature, I'm not going to dispense these medications if I'm the pharmacy. So the pharmacy calls immediately, says, hey, you're missing the DEA number. Oh, I don't have one. Then sorry. Well, a medical doctor is not going to do that, because they know that we need that in order for us to prescribe this medication. But just an example, that a medical assistant decides to call on behalf of the doctor, says, hey, pharmacy people, prescribe this patient. The doctor decides to order this medication. No, medical assistants, nurses, no one can call, just the doctor, for this type of schedule or level of medications. Basically, that's how it works. So you need to know what is the DDA. Remember, this is the Drug Enforcement Act. So you need to know. Or administration. Remember, A stands for act or administration. Well, most of the time we use administration. Drug Enforcement Administration. This is for the medical doctor. Has a license, it's a voluntary license to prescribe medications that are Schedule 2 or Level 2. So that's basically what it is. Any questions about the DEA? Is the DEA the most important thing? And if you have questions about the FDA, they're gonna ask you which of the following organizations approves medications to be brought to the market. Because if the FDA does not approve the pharmaceutical companies to bring their medications and put it in the market so people can buy it, then there is no such a thing. It will be illegal. So you have to pass through the FDA in order for you to come out with new medications. All these medications that we see in the pharmacy, they are approved by the FDA, including over-the-counter medications. So these medications or these chemicals, because they're not medications, that you buy at the GMC, all these proteins, these vitamins, these multivitamins, they are not approved by the FDA. If they are not approved by the FDA, if you take it, it's under your own risk. So you have to read on the bottle which ones are approved by the FDA. So if something happens, this organization, this store is going to be responsible. This pharmacy is going to be responsible for you. But if you do not read and you take something that are not FDA approved, that means that if it is FDA approved, means that they went through all these regulations and every single step of this manufacturing of this medication, they were checking that they met all the requirements. If it's not, it's someone else who's doing this for business and they don't care about the content of whatever is in that pill, tablet. And if you take it under your own risk. That's basically what's going on. So it has to be FDA approved in order for you to have a case, in order for you to sue someone. Yes, you can sue someone because that's illegal. But then they're going to ask you, do you read the bottle? It was FDA approved or not? Oh, I didn't. Well, remember, ignoring the law does not imply, ignoring the rules does not imply that you didn't know. So that's not an excuse.
Professor,
Yes.
I must say we should sue the FDA
Mm-hmm.
because the things that they allow for us to consume is just horrible.
Well, Mercedes, this is the thing. These medications are chemicals. These medications are foreign bodies. But when the FDA approved this medication, it's because the benefits outweighs the negative part, the negative results, the side effects. So there is nothing perfect. So for some patients, remember, not everybody reacts the same to the same medication. See, a medication that might work for you, I might be allergic to it, might cause damage to other organs. Remember, these are foreign bodies. There is no 100% guarantee that this medication is going to work and it's not going to cause anything else. No, they help you with something, but the risks are less than the benefits. And that's where the FDA comes to play, because they're going to decide whether the benefits are better than the risks. If the benefits outweighs the risk, they approve the medication.
No, I get what you're saying, but at the same time, it's not just medicine. It's also like the food, the ingredients they allowed in the food.
Oh, that's what I'm talking about, Mercedes. Is the components of the medication. Because when we take medication, let's say you're taking vitamin B. Well, the medication is not made only with vitamin B or vitamin D or vitamin C. No, there is a bunch of other additives that are going to keep these vitamin B, D, E, C inside. So we don't have 100% vitamin D that's given to us or any other type of medications. There is always these so-called, let's say for us to understand, ingredients, which call in medicine additives. That's what it's called, additives, because we add other things to get this medication protected. This is like using a preservative in food. I don't want this milk to spoil tomorrow or 2 days. We want to last 1 week. So I'm going to add some preservatives, some chemicals, some additives in there. And it's not the milk that is causing me the harm, it's the additives. Because my body reacts different to certain additives. And all depends of how my immune system is, how my body is responding to this chemical, how my organs are functioning. So there's lots of things that we have to take in consideration when we ingest a foreign body. And if you read the insert of the medications of any chemicals, read the inserts, not what is good for the medication. Oh, what is the action? Well, yeah, this is for hypertension, this is for diabetes, this is for gastritis, this is for cancer, well, whatever the case may be. But read more. What are the side effects? What are the contraindications? But we don't do that. We just take the medication because we trust the person that prescribes the medication. But this is not just the medication, like you mentioned, just any food that we eat. So food that we keep and they can last long and we can keep them without spoiling. These have lots of additives, lots of ingredients that prevents that. And that is what's causing us diseases to other organs. So that's no secret. But once again, this medication might be good for some people, might not be good for others. But everyone is going to get some bad effects. Why? Because they are foreign bodies. They don't belong to our body. But then they can prolong your life. They can stop this from worsening. So we give you the medication. Now, this is going to cost you something else. Unfortunately, again, we measure, pros and cons, benefits and risks. And nobody's going to change that because there is no miracle pill, something that is going to work just for that and nothing else is going to happen. No, we take something for something. And then they gave us another medication to counteract the side effects that this medication causes. So now I don't have one condition, now I have two, or maybe three. So you're right. Unfortunately, that's how it goes. Anyone else? Any other questions? Now, remember the FDA, if a medication is causing lots of, risks after it's been approved, they're going to remove it from the market. And it has been the case. Lots of medications have been removed from the market. The FDA removed that. And those foods that you buy in the supermarket, if they found out they have salmonella, they have this particular bacterial infection, they're going to remove it. They call it recall. So again, this is, a double sword, a double-edged sword. See, you can receive some benefits, but at the same token, you can, get other conditions based on the medication that you're taking. But it's not the medication itself, it's the ingredients that is causing you that. So when we get to pharmacology, we're gonna talk a little bit more about that, and you guys gonna get kind of understand it better, but I just explain you what's going on. Any other questions? Thank you, Mercedes, for asking. That's very important. And sometimes, layman people, you just don't understand this. But there is the case also when we don't take the medications as prescribed. That's also another factor. That's lack of compliance from the part of the patient. See, sometimes the medication do not work and causes side effects because you don't take it as prescribed. See, if a patient is being told to take the medication 7 in the morning, you have to take it in the morning. If it has to be taken before meals, after meals, you just have to do that. If the medication is being taken once per day, you cannot take it at any time because these have some type of, process that we call it half-life. So half-life, we will discuss that. But again, if we are not doing our part, these medications is not going to work. It's going to cause you more harm. So it's not just the medication itself, it's the way that we take it. Or if we take more or less, not on time. So we have to follow the instructions. Regardless, following all those instructions, medications are going to have side effects. Yes. Every single medication is going to have some type of side effects. Something that are going to be more pronounced for some people than others. Some that you might not feel the side effects yet, but then it's going to be damaging something else very slowly. And later on, you're going to notice the consequences. So it's very hard to determine because medication can cause something immediately after taken, or it can take time for you to recognize, to start feeling, to having symptoms, and for the doctor to detect that something else was wrong. That is the reason that when we prescribe you medications, and we know that these medications have the very, very common prevalent side effects, we do blood work. Very often, we're going to evaluate the level of toxicity of this medication on your body. And that's when your responsibility comes to play, because if I tell you, you have to come back for a follow-up to do this blood work, and you do not show up, well, you're not allowing me to see the level of toxicity, whether this medication is actually working for you, whether the condition is getting better, or this condition is not improving, whether I'm giving you too much medication, whether I need to taper it down, or I need to increase the dose, or I need to add another medication. So this is a lot, what we have to do with medications as medical providers. It's not just prescribing a medication and that's it. There are more to it. And remember, this is a relationship. This is the medical doctor doing one part. This is the patient doing his or her part. But again, bottom line, medications causes side effects, some worse than others. Is written. It is written in the medication insert. So the paper that comes with all the instructions about the medication, all the medication information is going to tell you. And you're going to be surprised. Next time, if you're taking a medication, read it. You don't have to be taking a medication. Go online, type any medication for diabetes, for arthritis, for this, for that. Try it and read what are the side effects for this medication. At least they're going to give you 5, 6 side effects for each medication. And some of them are worse than others. They damage other parts of your body. So again, it is not a fair game, but that's how it goes. Any questions? Anyone else? Okay. So I already mentioned this prescription of controlled substance, particularly Schedule 2 or Level 2. See, I already mentioned that you do not, I'm talking about the medical doctor, say, cannot be refilled. So patient is asking for hydrocodone. Okay, I gave some type of a number of pills for that. And the patient comes back again and says, oh, you know what? I got the good stuff that you gave me last time. That's what they tell you. What is the good stuff? Oh, hydrocodone. Or this medication that has codeine within. Oh, I want methadone because it's really helping me. Well, we cannot do that. In emergency, we give you once, so you go home. And this is not 30 times, 30 pills for the day, no, once, twice, 3 times per day. No, this is for a few days. Then, if you want to keep on taking this medication, then you need to go to a pain management doctor. And they're going to do the pertaining evaluations. And if you need the medications, they will give it to you. And every time that you need it, you're going to come back, but we're not going to give you refills because we have to evaluate you to see how the medication is doing inside your body by drawing blood and evaluating other physical and emotional and psychological aspects. Because most of these medications are taken because you became addicted to it. You have some time of drug abuse. That's why we require a DEA license. See, I'm not going to be monitored if I'm prescribing medications for arthritis, for gastric problems, for cancer, for anything else, for diabetes. They're not going to monitor me for that. They're going to monitor me as soon as I start prescribing this Schedule 2 or Level 2 drugs immediately. Every single move that I do, they are there because this prescription goes directly to the FDA. So the pharmacy is going to send it immediately. Oh, the doctor does prescribe this. He's prescribing again to the same patient. Oh, wait a minute, something is going on. They immediately remove my DA and get me in trouble because I'm not supposed to be prescribing this medication. That's why we have a specialist. We're going to send you directly to the pain management. Because most of the time you take these medications for pain, for chronic pain, for severe pain. Now, if this patient is hospitalized with pain caused by cancer, that's a different issue. Then we're going to give you morphine. And we're going to give you a drift. So it's going to be on your intravenous infusion. But that's a different issue. You're being cared by us, and there is a doctor, there is a nurse there, monitoring you every single time. But for you to take it home, no. So that's basically what it is. So every single time that I prescribe a medication, pharmacy is going to send immediately that prescription, that my registration number. and that is it. So basically, that's it with this law and ethics. All right, any questions? Because we done. Tomorrow we're going to start with another chapters of another module. So I'm going to send you these later on, the chapters that we're going to be covering, so we can start a new chapter. Tomorrow I will be sending you an exam for this module. It's not going to be too many questions because it's not too much what we cover here. So just make sure, remember that you review it, check your notes, just make sure that you get, your answers right. You don't have to get all the answers right. Try to do it first, try to test yourself and see how many of them you got right, and then you review your materials. That's the reason why I'm giving you this. Because these are very tough, subjects, and I don't want to be just, okay, I'm going to give you tests, I'm going to be timing you, I'm going to be asking you to come to school, to class, and I'm going to be there. No. This is something that you need to learn, and this is something that, you're going to have some time to, to grasp some of this information, and only will be good for testing and for some of the things, you're not supposed to be doing at work, just for you to understand. But this is testing issues most of. So for that reason, I do, I use the way that I use to give you a take-home test, and I will give you, like the weekend for you to work on it, and, then you send it back to me. So I will be sending you emails. All right. Okay, so then thanks again for joining the class, for participating. Have a good night, and I will be seeing you tomorrow, same time. Okay?
Good night.
Good night.
Good night, Joseph. Good night, Mercedes. Good night. Take care, guys. Enjoy it. I know you are very upset because I'm letting you go early, but I'm sorry. This is just me.
Good night.
Right?
Thank you.
Okay, you're welcome. Take care.
Thank you.
Good night. Get some rest.